Now, here in the desert, a big concern is our skin, not just keeping it beautiful, but also keeping it safe.
That's right, and I spoke with a dermatologist about skin cancer and how we can prevent it. Well, 1 in 5 Americans will develop some form of skin cancer, and each year there are more new cases of skin cancer than total cases of breast, prostate, lung, and colon cancer combined. But skin cancer isn't just the most common cancer, it is the most preventable. Joining me this morning with more information is Dr. Ronald Harris, Health Sciences Clinical Professor of Dermatology from the University of California. Doctor, thank you so much for joining me this morning.
Thank you for having me.
So, doctor, let's start with the facts about skin cancer. What can you tell our viewers today?
Well, I'll tell you what, you said probably the most important fact just a minute ago, and that is 1 in 5 Americans will get skin cancer at some point in their life. And that translates to somewhere around 5 million cases of skin cancer every year. Of those, about 65,000 will be malignant melanomas, which are invasive malignant melanomas, which are the most dangerous type of skin cancer, potentially dangerous, and about 9,000 of those, unfortunately, will die from their disease.
Wow, and you know, I'm coming to you from Arizona, the desert, so we know just how serious, skin cancer is, but maybe share with our viewers,
Yes.
Your opinion on why skin cancer is such a serious issue.
Well, I think the problem is for most skin cancers, if you catch them early, and you either excise them or you do something topical to them, it's cured. And I'm sure in Arizona, as well as what we do in California, we do skin cancer surgery every day. And for the vast majority of those patients, once we do the surgery, it's done and they're cured. The problem is, though, that some of these cancers, if left to fester, can cause local problems in the skin. They can cause disfigurement. They can cause loss of function, and later on potentially go onto different parts of the body and cause problems there.
So, doctor, what is it really going to take for us to see kind of that decline that we're looking for in skin cancer incidence and death rates?
Yeah, I think Americans need to take skin cancer a little more seriously. We talked about potentially dangerous types of skin cancer, and one of the things that I think would be really important is for people to wear sunscreen every day, not just when you're outside or when you're going for a hike or on the golf course, but wearing it every day, whether it's sunny or cloudy, and going to see your dermatologist at least once a year. And if you're high risk, meaning that if you have a history of skin cancer before, or if you have lots of precursors to skin cancer, you probably need to see your dermatologist a little more often, maybe like every 6 months rather than every year. So those are things I think that could be very helpful. And then if you have something that you're worried about, don't let it fester. Go see your dermatologist. If something's changing or something hurts, then go see your dermatologist and have them check it out and maybe do a biopsy.
So, doctor, I like that we're really talking about preventative measures that we can take, and then also, not letting things sit. If you see something on your skin, you're not sure what it is, go to your dermatologist. Is there anything else you want to leave our viewers with this morning?
Well, the fact that I think that there are some advances since then, so there is some good news. There are some advances in surgery. There are also advances in types of medicine that we can use for advanced cancers, particularly advanced basal cell carcinomas. There is a medicine called Irvine, also known as Vismodegib, which is used for basal cell carcinomas that we don't want to treat by surgery or radiation, or can't be treated by surgery or radiation. And it's been quite effective in those patients. Certainly those medicines have side effects just like anything else, and this can affect unborn baby. So you need to have the patient needs to certainly discuss risks and benefits with their physician.
Absolutely. Well, doctor, I want to thank you so much for joining me this morning with this very valuable information for our viewers.
Great. Thank you for having me.
Now stay where you are. The Morning Blend will be right back.